Now we can start.
So very good evening, ladies and gentlemen. I'm Rakhi Bakshi here from Her World India. And right now we are bringing to you this show every day and not only on Saturdays as we did earlier. The whole idea is to create this platform to address social issues. We, of course, have been targeting mainstreaming gender issues. We've been talking to lots of women in all sectors. But right now, we feel that it's a crucial and critical time. We are struck by coronavirus and the COVID-19, its second wave, which has really, really badly trapped all of us. At this sad time, we are losing our dear ones. Some of our relatives are battling in hospitals. There are all kinds of challenges we are facing, all kinds of problems in terms of medical support and facilities. Medical practitioners are also trying to do their best. But what is the whole situation like? Sometimes, people are asking on social media what to do, what not to do. And that's where we thought that at Her World India, we'll talk to two such medical professionals who are females also, and let's understand from them as to how it is being dealt with, how it is for them, how is the situation for a patient right now who's COVID struck, and what best can we do. So to introduce you to eminent speakers with us on Her World India, Dr. Sonali Shetty joins us from Mumbai, is a senior gynecologist, but will give us insights and ideas on what's happening on the ground. I'm also thankful to Pankti, who joins us from Gujarat and who's right now on COVID duty. So she'll give us the very, very first-hand experience of being inside the hospital, looking after COVID patients. All of you can join in terms of not only participating, but asking us questions. We'll take that ahead. I have been researching on what to ask, and some of the practical questions that I have really been getting, I'm going to ask them for all of you. So first of all, Dr. Shetty, thank you so very much. At this time, I can't really put a lot of nice words here, but still feels little nicer, brighter that we are talking to two such energetic females who are right now handling duty firsthand, and what a commitment it shows. So thank you for being the warriors that you are. My first question to you would be, is that at this situation, how challenging has it become? All eyes are right now on doctors. Is to be a doctor, do your duty, still be a human being, and look at it from that multiple angle, so to say. Dr. Sonali.
Can you hear me now?
Yeah.
Yeah. At the outset, I would like to thank Rakhi and Her World for giving us this opportunity to reach out to women, to reach out to everyone with our actual what we are facing right now and what practically treatment should be done, and not rely on WhatsApp treatments. Okay, so the question that you asked, that how are we coping with the COVID pandemic, okay, as doctors, as medical health workers. See, it is very difficult for us because we have the responsibility of not the patients, but also our families. Okay, so we see patients in the wards, we treat them, okay, we give them guidance, but we also have the security that after treating the patient, maybe we are carrying it back home. So people should understand that also, that doctors are working in the forefront, saving lives. They also have to take care of their own lives as well as the families that they are going back to.
Okay, the same to you, Pankti. We will come to some very pointed questions, but Pankti, who joins us from Gujarat, somebody who's really, really handling, she's on COVID duty right now. How challenging you feel, Pankti, is the job that you're doing right now?
I think it's been really challenging. I think that we are fresh interns. We've just begun actually being on the job. So I think that we've had to grow up a lot in a very short amount of time, because my colleagues and I, we've had to go and triage patients. We've had to prioritize patients because there is so much patient load, and because we work in a tertiary care center, so we have we have to deal with cases which are on the worst end of the spectrum. So we've been seeing filling up ICUs like anything, and it's been very difficult because we've had to deal with so many emotions, our own as well as the patient's relatives' emotions. We've had to learn how to counsel them, and it's definitely been really hectic, and it's been very challenging for sure.
It is going very hectic, but I think fills you with a lot of responsibilities. I come to Dr. Sonali. First question is that since you are a gynecologist and we are also talking about a large section of women, either they are women patients who sometimes don't know how to really carry out some urgent medical support attention, but also some of them who are maybe alone at home, and then how to manage COVID patients or relatives. What is your experience? How much of difference do you find as far as women patients themselves are concerned, or women who are bringing patients?
It is very difficult for women. See, what is happening right now is all the hospitals, okay, be it private or be it government, they are all converted into COVID hospitals. It really affects us women, because what if there is an ectopic pregnancy? Ectopic pregnancy is pregnancy outside the uterus. It is a life and death emergency. But such cases may not get beds in hospitals, because all the hospitals and ICUs are filled with COVID patients. So it is very difficult, especially for women and their difficulties. They have menstrual problems, they can have a menstrual emergency, they can have a delivery emergency, they can have preterm labors. Such patients are sidelined because all the hospitals are filled with COVID patients. It is very difficult to manage them.
In fact, Dr. Sonali, today only on Twitter, one of the persons that we know, a senior doctor here, Dr. Shafi, in fact, wrote that how they're expecting a child and how they are worried actually as to how it all will happen. How do you really see such cases at this stage?
Yes, we do see so many cases. See, I also run a private hospital. I am attached to a government hospital also. And I really have to take into consideration these emergency cases, because they are also, they need to be triaged too, because that is also a life and death emergency. See, delivering a preterm baby, an ectopic pregnancy, menstrual cyst, these people need beds. These people also need ICU. So you really need to work in tandem with the government officials and your own hospitals for your own patients, so that they also get the treatment at the right time, even if they are not COVID.
I read a very heartbreaking, news today where a man is writing that how his wife, who was pregnant, but also succumbed to COVID. I mean,
Yes.
How would you see such cases where somebody is pregnant, a woman, but was also battling COVID?
Oh my God. I have a really, really bad case close to my heart. I had this patient who was infertile for 8 years. She did an IVF consultation and she got pregnant after IVF treatment, okay? And the family was really happy. After 8 years, she was pregnant, and she was about due to delivery in September. But what happened was, she didn't follow up with, because of COVID, she didn't follow up with any of the doctors for pregnancy. She attended a wedding, and then she came to me at delivery with her SpO2 at 70. I had no option but to refer her to a tertiary care center for an emergency cesarean section, where unfortunately the mother succumbed, the child survived. So it is a case very close to my heart, and it really, really breaks my heart that even such patients are not prioritized, and they don't follow up. Imagine the plight of the family, that now they have a child, but now they don't have a mother. So these cases I have seen with my own eyes, and
I think my heart goes out to you also, doctors like you who are watching these patients. You feel so helpless. Some of you are writing about it also. You feel so helpless that you want to, help them, support them medically, but at times you just cannot do it because it's not in your hands. Pankti,
yes.
Seeing it firsthand as you do in COVID duty, what are some of the experiences you would like to share? I mean, especially, sometimes I've seen young girls. In fact, one story that we all read is that how one young girl first succumbed to COVID, and then seeing her go away, even the father later succumbed, such tragic stories. What are your experiences? How do some of these women, manage? Some of them are maybe single, some of them don't have much support except for maybe their male relatives who they are coming with, who are patients. What is your experience?
Mostly the wards that I've worked with had stable COVID patients, but I've seen that there's two very different experiences depending upon where you're working. So if you're working with stable patients, you're more likely to see them recover and watch them go, which is very satisfactory, to tell you the truth, because most of the people see the opposite end of the spectrum in our hospital. So it's very satisfying to see them recover fully and then thank us and then leave the hospital in good health. But there's also the other end of the spectrum where we have patients in the ICUs who are critical and who have succumbed to COVID. We are seeing so many deaths per day. One particular case involving a woman who was posted, who was also admitted where I was posted. She had a very high risk pregnancy already. She was some in her 30s, which is considered a little bit on a risky side, because after 30s you have more chances of complications. Plus, she had thalassemia, which means that her red blood count was really affected, and her hemoglobin was really low, basically. And so she was already very high risk, and we did prioritize her first, and we tried to. She was already like 6 months into the pregnancy, so we tried to supervise her more often. But what happened was, even though she did not have a complicated course, because we had intervened early, we'd taken care of her, we were keeping a close watch on her. We even gave her blood transfusions. But when the doctor said it was okay for her to go home, she did not want to go home. And she did not reveal at first why she did not want to go home. But later on, I found out that she confided in me, and I found out that her husband was also suffering from COVID, and he was in one of the critical care units, and he was on oxygen. So she was actually scared to go home, because she said that she didn't have anybody else to look after her. So that really broke my heart. I made a promise to her that I would try to find out from my colleagues how her husband was doing. Eventually, though, I think that they both recovered and they went home. But that was a story which was close to my heart. So I kept on checking in on her and made sure that she had somebody to talk to.
Yeah, there's so many such heart-wrenching stories actually are coming before us. Dr. Sonali, talking about women coming from rural areas, women who we think are not really so much aware or educated about medical, elements. So how do you deal with them? I mean, they don't have much knowledge. Somebody can misguide them. And the whole job here also in this show is to really tell people what's right and what's wrong. How do you sometimes deal with such women, Dr. Sonali?
Yes, hi. Rural women, these days we think rural women are less aware, but no, this is not the case. I work in rural area also. Rural women also are aware due to this social media, WhatsApp and other social media, those are also aware that what should be done and what should not be done. The only problem is they don't have the resources to go ahead and reach out to us. Okay, so in rural area, what happens, sometimes ambulance is not there, doctors, GPs are mostly not available, specialist doctors are not available, they don't have specialist CT scans or sonography or x-rays also, even in some areas. So the problem remains that they don't get timely health care. They are aware that what should be done and what should not be done through social media, through friends, or through community also. We also go in the rural areas, in the interiors, and give them knowledge. But the problem is they don't have the reach. Okay, they don't have the reach. They don't get timely ambulances, medical care. That is the only problem. But otherwise, I think women in India, be it modern, be it metropolis, or be in rural, are actually very well educated, and they are very well aware of what is going on around them.
Okay, good. So other thing that, Sonali, which is a related question, is that how much are they supported or prioritized? We are also talking about understanding their needs more. For example, we are also talking about women who are handling things at home. At times there are conflicts. They're handling some of their marital, social problems, and some other added responsibilities at home. And they're also battling maybe their own COVID situation or their relatives being COVID patients. Would you share some of this experience as to how women who are supposed to be multitasking or handling multiple challenges are actually dealing with it?
Yes, it is very difficult for a woman, because you say Indian woman is karta dharta of the house. If a woman falls ill in a house, the entire house falls ill. This happened to my own best friend, who's also a gynecologist, and she has a 9-month-old infant also with her. So her entire family came COVID positive. Her mother-in-law is suffering from cancer also, and even she was COVID positive. Father-in-law COVID positive, husband COVID positive. Only the kids were spared. But what happened is, being senior citizens, the mother-in-law and father-in-law both had to be admitted in the hospital. The husband was alone, and I had to take care of her children. So I am very happy that I could help her in these trying times. Unfortunately, she lost her mother-in-law, who was battling COVID as well as cancer at the same time. So multitasking, even if we are, as women, we are multitasking, we are managing our homes, we are managing work, we are managing everything. But still, at some point or the other in your life, you need support, different from the family, away from the family. Like I helped my best friend to take care of her children till she was out of the quarantine. They could not even attend the last rites of their mother-in-law. This is what is happening.
Okay, we'll come back to you also about what people should do, but let me go to Pankti also. And Pankti, sometimes, some of the queries they ask you, in fact, you have to be very patient also as a medical practitioner. How is it to deal with people who know less about COVID actually? In fact, we've heard such stupid kind of, if I may use the word, statements where some people think, oh, there is superstition, that there's nothing like it, and what exactly is the disease or how will it go, kind of thing. So they must be asking you such things. How is that experience?
I think that so we are on this end, on this side of the story where we know everything about COVID, most of the things that, and whatever we don't know, it's just still being updated. So we have to stay updated. We have to make sure that we know whatever the recent data says. So on one end, we understand the disease, we deal with it every day. But on the other side, there are people who've not seen it. There are people who have not had any experiences with it. So whatever they're saying is coming from that, the lack of experience, the lack of knowledge, lack of awareness. So I think that in that sense, we just need to keep a cool mind, and we need to make sure they understand that this is something serious. My family is a family of doctors as well. So, but even we have had to deal with such queries quite often. And even in my posting, there were times when, because there are so many patients, there's like, we had like 60 patients and only 3 junior doctors to look after them. And a consultant would come every morning, and he would look at the patient, and then he would inform us like what are the things that we're supposed to do for that patient on that particular day. So very often he could not answer all of the queries that they had throughout the day. So they would then approach us and ask, okay, what do these reports indicate? What can I make of this? Is she getting better? Is she getting worse? This one time, one relative got very angry also and started yelling at us and all those things. And it was really bad. The tone that he used was also not very decent or very, very nice. But I still made sure that I calmly took 10-15 minutes and I just explained to him and his wife the entire disease pathogenesis, how it infects the body, what are the clinical manifestations, what do these reports indicate, why are we getting them done in the first place. And then later on I went on to, okay, your relative is improving, so it might be that our consultant will take a discharge decision tomorrow. But I cannot say for sure because I'm not in charge of these decisions. But yes, I can help you understand whatever you need. So I think it's very, very important as a medical professional to just keep your calm and solve their queries, because they are coming from a place where they do not know about this. And we're coming from a place where we do know. So the only way to deal with this is to fight with information. I'm a big believer in that COVID is not just about frontline warriors working day and night. It's about fighting with spreading the right kind of information.
Very true. And you're working on those data, judiciously, as you say, also on that. And I'll come back to you on that. Dr. Sonali, some of the things, for example, right now the vaccination drive is on. People have all kinds of queries. Even I can tell you, people like my friends, me, we all have our apprehensions. For example, when you go for the vaccination, how much safe it is, how much will it protect you from not having COVID, what you should eat, what complications will you be having. So people think that if you're going there, you will have fever, you will have maybe 8 days or 7 days problem, that you will be unable to do or march or be active. What are those things that you'd like to share, Dr. Sonali, as to when somebody, of course, must go for vaccination? but what are the things around it that you'd like to inform the people?
Yeah. See, for vaccination, I would like to inform that vaccination is very, very, very important, and it saves life. It saves lives. So, and secondly, these days what happens is, vaccination centers themselves have become a spot for spreaders. What happens sometimes outside the vaccination center, there's so much of crowd waiting to go in. There is no social distancing, mask, or helter-skelter everywhere. So these days, vaccination centers have become the hotspot for COVID spreading. So what we need to do is we need to educate people that why social distancing is important. You are going to take a vaccine. That doesn't mean that you should not follow the rules of social distancing, because that actually deflects from the actual cause of vaccination, that is to protect you from the vaccine, and you are doing exactly the opposite of it. So while going for vaccination, I would suggest everyone to maintain social distancing. Your time will come. You have taken an appointment, your time will come, and not gather around the vaccination center to themselves. And secondly, wear a mask and do not talk in the vaccination center. Once you talk, you are spreading aerosols. Okay. So when you're going to a vaccination center, wear a mask properly, don't overcrowd, and please don't talk unless important, especially outside when there is a lot of line and all going on. So this is what I want to tell you. But vaccination is very, very important.
What about further complications? Would you like to say something on that?
Yes. See, after vaccinations, be it any vaccination, I'm just not talking about COVID, but any vaccinations, see, those who have children would actually know, after TPT vaccination to children or BCG vaccination, there are some symptoms which are common to all vaccinations. Number one is fever, pain in the injection site, and myalgia or body pain. Okay. There can be mild symptoms of flu also after the COVID vaccination. Okay, which is slightly runny nose, headache. Okay. These are the symptoms which are very, very common, which are not harmful. If you have fever more than 4 to 5 days after vaccination, you should go and see a doctor. But they subside on their own. Okay, fever usually remains for 2 to 3 days, which is mild grade, not high grade. Body ache can remain for 2 to 3 days. Okay, and headache can remain for 4 to 5 days. But people think that after they get vaccination, they will get infected by the coronavirus. No, it is not that. These vaccines are inactivated vaccines. They don't contain the virus. They just contain one part of the virus, which will cause an immune reaction in your body, that just in case if you are attacked by the virus, then your immunity is ready to fight. So this misconception of getting the vaccine and then because of the vaccine you're getting the COVID infection is absolutely wrong. People should understand this.
Okay. No wonder that your Twitter name is Jeevan Daini. Let me inform to the viewers. And Jeevan Daini means life giver. So this Dr. Sonali is somebody who's at it. She's providing life to many and trying to also protect many lives. And we are really, really thankful to her. I also ask you this, that so before and after, people may be asking this, what to eat, what not to eat. So whether somebody should carry some snack or something, or if snack, then what kind of snack, whether they should avoid certain things or post-vaccination. Would you like to inform?
See, I'll tell you one thing. It is very funny. There is something called injection phobia, okay, to the patients. And some people, like, they see the injection. We have seen 2 or 3 videos also on social media.
I'm like that. Let me inform. I have a phobia myself.
It is like that people see the needle and then they faint. So for those people, snacks are important. Okay, those who just faint by seeing the tip of the needle, for those people, snacks are important. Okay, you can go with a full stomach to the vaccination center, no problem. Keep yourself well hydrated. That is why we have mandatory 30-minute period for a post-vaccination, because just in case if the person faints or has some uneasiness, they can be immediately attended to. Okay, but otherwise you can just go on a full stomach and be positive that nothing is going to happen. Otherwise, nothing to worry.
Okay, there are many more questions that I want to come to you, Pankti. And when you're talking about data, one of the things I want to come to you first, I had too many questions, is about testing part. And also the fact that how much of your negative report matters. That many places today, only I was reading that I think now in a COVID hospital it will not be that important to carry that RT-PCR negative report. Would you like to clarify on that as to how people should deal with the testing part? I mean, some figures come in that less testing is happening, less figures are being shown. Then somebody says that, when I'm going for testing, it's not happening as quickly as it should happen. So what is the whole scene like when it comes to testing?
First of all, there are two types of tests that we're doing to diagnose COVID. Like, let's say there's an RT-PCR test and the rapid antigen test. The rapid antigen test detects the live viral antigen. And it's rapid, so you can get the result right away. But the problem with the rapid antigen test is that it can give a lot of false negatives also. That means that the person might be infected, but it will not show up on the test. So if you want quick results, yes, rapid antigen is a good choice. You will just get the result right away. So if it's positive, you don't even need to go for an RT-PCR. That means you are infected. But if it is negative, then it's not confirmed that you are not positive, that you're not infected. So then you have to go for an RT-PCR test, which basically picks up the genetic material of the virus. Now, the genetic material of the virus, it will pick up. So it's a confirmatory test that if you are positive, you are infected, if you are having symptoms. But what happens is that a lot of people have this misconception that even after you've recovered from the symptoms of COVID-19, or even after your hospitalization, you again have to get an RT-PCR test. And only if you're negative, then only you can come out of isolation, or then only you're done. It's not like that. Actually, the RT-PCR only picks up genetic material. It does not differentiate whether the virus is live or whether it is dead. So that's why it can be positive even after you've recovered from the illness. So there is no need to actually advocate for a repeat RT-PCR testing. If you've done it once and it's positive, then that is enough.
Okay.
But yeah.
Another question that people ask is that till the time they're getting their report done and the testing has happened, what is it that they should do? So somebody advises that you can start really treating yourself. How much of emphasis you would give on self-treatment or self-medication there, and what kind of medication?
Right. So if it's let's say that it's the first day of symptoms, then I don't think that like, at least here we usually get the report at least by in the span of a day. But in some states, I've heard that it takes a lot of days for the report to come back. Now, the worst part of COVID-19, whatever the worst progression that we're expecting, it usually happens on between the 5th and the 7th day. So you don't want to wait that long before starting any medication. It's best to consult a doctor, and if they think that clinically, yes, this is COVID, or if you have a very strong history of contact with COVID-19 people, then it is ideal to start medicating, but not self-medication. I would still suggest that take the advice of the doctor. Do it as per what they say. Usually, they'll so far the only treatment that's been found very effective in COVID-19, especially in the early days, is just hydration and paracetamol to keep the fever down. Some people suggest antibiotics, some don't, but that is basically to prevent infection. It is not for COVID-19. It is to prevent secondary bacterial infection. But it's best to just leave it to the judgment of the doctor. It's best to just consult them and what to do till the report comes back.
Okay, Dr. Sonali, a lot of people right now, as we are talking about, and all of us are watching on social media, especially on Twitter, that we three are, that there's a lot of panic, how to get beds, how to get ventilators, oxygen support, to right kind of medication. So some people would say that, not everybody needs a bed, and then why to really, fight for a bed? What would you really say about it? That what could be the condition? Because right now authorities are dealing with hospital bed problems. There are challenges. Even primary healthcare is not so adequately available in India right now, and we are talking about big facilities. So how would you really look at that, Dr. Sonali?
Yes, actually, our health infrastructure is not up to date, and that is why people are fighting for beds. But the good part about COVID is that there is a 98 to 99% recovery rate. So here, when we are talking about people not getting beds, not getting ventilators, those are the 1% or 2% of the patients who are going into the severe category. and not in the mild or moderate category. That is where our health system, our trial system, like Dr. Pankti, front healthcare workers, the trial system comes that who should get beds and who should not get beds. There are some elitist and some rich people, they are like, nahi, 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 RT-PCR positive aaya, they are running for beds and they block the beds. I have seen it. I have seen rich people, I have seen elitist people blocking the beds. And when actually severe and moderate people who need ventilators and who need oxygen beds, they don't get it. So it is really what I don't know. See, our system is not well functioning that way. I think so.
Also, this whole oxygen, I mean, unfortunately, we are also watching that there's so much of oxygen need. And of course, there is a huge demand and supply kind of challenge that we are watching. Every day we hear some state asking for oxygen support from the center trying to augment, and the oxygen plants are now being looked at, things like that we know. But how much sometimes one feels medically is that really a patient would need that, because we are also hearing cases now that people are hoarding, there's black marketing happening. I'll also come to remdesivir, which I was shocked yesterday that the kind of price that it was available at was really huge. What does one do? What would you tell the patient in this case?
See, actually, what we are talking here is about infrastructure and logistics, where we don't come in. Doctors, we are supposed to treat the patient in the ward. We are supposed to take care of the patient, and we are not into these logistics. See, getting the oxygen, we are working in the hospital, we are workers. It is not like we are running the hospital. We don't run the hospitals. We are taking care of the patient. So this oxygen, remdesivir, drugs, these logistics come to the hospital administration and the local administration. They are not in tandem. See, what people do is, it is a B2B. Doctor treat kar raha hai na, doctor ke paas oxygen hona chahiye. But we can't bring oxygen from our homes, right? We can't bring oxygen from our homes. We are treating patients. We are doing one-to-one thing. So I don't think so. Doctors should be blamed for the oxygen shortage or the remdesivir or tocilizumab
not being kind of available at times. Yeah, there is a voice problem happening. Can we hear you?
Yeah, can you hear me now?
Yeah. Please go on.
Yes. So we are not producing oxygens from our homes. People should know that. So when people ask doctors, what is your view about people not getting oxygens or dying because of shortage of oxygens? We have a straight statement that we are not responsible for oxygens. What we can do is we can just inform the authorities. We can, some doctors are actually begging the authorities, that are hamare hospital ko oxygen do. Some people actually begging. You can see on social media also. Many doctors have died because of shortage of oxygen. But people should understand that the frontline workers are not responsible for the oxygen shortage or its consumption.
Very true. In fact, I would like to repeat what you're saying. It's very important what you said, that frontline workers like you are doing their duty. They are attending to COVID patients with the knowledge of medical education that they have got, but it's not their job to handle systems and management, which is entirely a different structure. And we must understand and screen that. At this time, we are, of course, also talking about this whole hospital management to health infrastructure in place and the whole health chain in the country being maintained. And these are questions, of course, bigger questions that we are also asking and will keep asking, and which is what I think the authorities, the government of the day must act upon. To you, Pankti, again, any do's and don'ts, because if I remember today, one actor wrote, and he said that, okay, if after vaccination I've come home, I want to chill, I want to smoke and drink. What does he do? He's an actor from Mumbai, actually, Dr. Sonali. And I wrote on Twitter, I said, I'll ask you a question.
Shall I answer or Pankti's answer?
Yeah, sure, go ahead.
No, Pankti, you can answer.
Both of you can answer.
It's just that smoking and alcohol also weakens your immune system. And with the reason we're taking a vaccine in the first place is because we want to strengthen our immune response against COVID. So it is not advisable to come back and smoke or take a drink, go for binge drinking either. It's not advisable. And why do that? Like, why take that risk? Because anyways, COVID-19 is going to damage your lungs, and smoking also damages your lungs. So it's not really, you're not really helping anything. I mean, the fact that you took the vaccine is reason enough to at least chill out. Chalo, ye to ho gaya hai, something like that. But if you are going to get vaccinated, it's not that you're going to be completely immune to the virus. So if you're taking care of other precautions, like going for masking and maintaining social distancing, not going out if not needed, then why not also quit smoking for a little while at least? Also, the fact is that, as she said, that after taking the vaccine also some people are experiencing side effects. So even to recover from that will become a little bit more difficult if you're also smoking and taking alcohol.
Yeah, that's what, you may never know the side effects are because of the smoking and drinking or after the vaccination. People are, like jumping around. I took a vaccination and got all these symptoms. They might be aggravated because of smoking and drinking also. So that is why it is not
advisable. Point again is very important.
You might attribute those side effects to the vaccine.
So Dr. Sonali, to add to that, what to do about people who say that no, because I'm very used to drinking and that relieves me of the kind of anxiety that I experience and all that, and that's where I see it as a medicinal support kind of thing. What would you say to these people?
No. Absolutely. I am against all this. Because you never know what might aggravate your symptoms. When you're drinking, it actually weakens, like Pankti said, drinking and smoking weakens your immune system. So when you're taking a vaccine, when your body is fighting to build immunity against a virus after taking the vaccine, that process is hampered. You might not get 100% immunity after you smoke or drink a lot after vaccination. That can be the reason.
Okay, another video that I saw, which said that, virus feeds on a lot of sugar, and that's why you should avoid food which has sugar content, including even some fruits. What food would you say is advisable and not? Because some of these things keep coming, people read them about it or watch videos, and they get a little confused what to eat, what not to eat in their daily routine. So is there any advice?
Yes. There is sugar. I don't know if I don't know where this came from. Maybe because COVID is people are suffering from COVID, and people who have comorbidities like diabetes, who have high sugar, okay, they are more susceptible to the virus and the disease. So maybe eating less sugar came from this connection. जिसमें sugar ज़्यादा होता है वो खाना नहीं है, but it is not the case. See, anyways, high sugar is avoided, whether you are COVID positive, COVID negative, whether you have diabetes, whether you don't have diabetes. We know sugar kills. Okay, excess sugar kills. So the point is not that you should not have lots of sugars or this. There is nothing related to diet that makes you more vulnerable for COVID. Okay, you eat more sugars today and tomorrow you got COVID, you can attribute it to that. Okay, so normal healthy diet that we eat every day, normal healthy diet, be it vegetarian, be it non-vegetarian, what we regularly eat, that you have to eat. There is no diet that will make you more vulnerable for COVID, and there is no diet that will make you susceptible to COVID. Okay, so this thing that sugar may cause COVID came from diabetes, I think so, because diabetic people are more susceptible to COVID. It came from there, but nothing related to diet. No.
Oh, so you have actually clarified the cloud also. 2-3 more things which are doing the rounds, and which you must be watching also. So, for example, talk about steroids. And today only I saw a doctor actually giving answers on that. The judicious use again. What would you say? I mean, there are all kinds of, this should be based on prescriptions, isn't it?
Yes. See, there are so many rounds. Even as a doctor, every day I get some forwards saying, the doctor's prescription, what happens is people try to copy prescriptions. It's like, yeah, this person has a COVID and he was prescribed these 10 drugs. Okay, fine. Copy paste. He goes to the medical and buys those prescriptions. They try to self-medicate. See, we know COVID is a immunity destroying disease. We know it is a hypercoagulable, which causes clotting in the blood and this thing. So we use steroids to decrease the flaring up of the COVID disease. We don't use it on everyone. So taking the steroids, okay, even the AIMS guideline says that steroids should be taken only and only under the guidance of a doctor and not otherwise.
Okay, sure. And in fact, we heard Dr. Guleria saying that too much use of CT scan is also not advisable. It amounts to almost more number of X-rays actually, and it only kind of gets harmed. So, but at times people are also going by what they are told to do. How to decide what is right, Dr. Soni?
Just ask your doctor. Just trust your doctor. That's it. That is the only way. Trusting your doctor, because we know the pathophysiology of COVID. We know in which patients steroids should be used, not be used. Remdesivir should be used, remdesivir should not be used. Which patients need hospitalization, which patient needs oxygen, which patients need ventilator. We will decide. Please, some things, please leave it to us.
Okay, let me add this and tell the viewers, all of you who are watching, that please trust your doctor. They are really doing their duty very diligently. And also this trust deficit that we see sometimes, we have seen some cases of scuffle when angry relatives have tried to target doctors, is not correct. I mean, please try and understand that they are also under a lot of pressure. They also have families and they are doing their duty. So I think I urge also on behalf of them is to please try and understand that they are only trying to serve you. To you, Pankti, now, talking about your data, how much of it, somebody is reading Lancet, somebody is reading that publication on social media. Again, we are reading that this is a new discovery. The third wave will come or not come. There are confusing statements coming even from senior people. What is it that we should look at in terms of the road ahead? What is our data saying?
I think that it doesn't, looking at what happened last year, if you look at the trend from last year, from the first wave, what we've seen is that we did anticipate a second wave coming, but we did not expect it to be so, to see such a high rise of cases. And that happened because the variants came in, because the variants currently in India, like the B1617 variant, it is said to be very infectious. So it transmits very quickly, even though the severity of the disease is more or less the same. But the reason that we're seeing that more hospitalizations are there this year, that we're running out of beds, we're running out of oxygen supplies, there's lots of factors which are contributing to it. One is that the variant is spreading faster. It's not that the variant may be more severe, but it's just spreading faster. So it's affecting more number of people. And that's why, as compared to last year, we're seeing more hospitalizations. Secondly, vaccinated population, like the data I've worked with, I've seen that this time we are seeing more cases in the younger age group, the people who have not been vaccinated yet, less severity in the older age group, which have been vaccinated. So that's very concerning, especially for us. So many times we're seeing people our age itself who are on oxygen, who require ventilatory support. And it's very concerning. So that notion that, younger people might just develop mild symptoms and, they may recover, that is something that we now need to actually closely monitor, because this time the statistics say differently. And as for the third wave, well, there's not much data, but there is a prediction that there may be a third wave somewhere in maybe say September or so. And let's see, hopefully that if we are able to get more people vaccinated by then it might be better than this, or it might be worse. We don't know. It all depends upon how many people get vaccinated in the next few months.
Vaccination is a very crucial and very important thing. And we are only talking to all of you that please get vaccinated, and that is very important. Dr. Sonali, coming to women again, how is it that woman, let's say, who has COVID, who is pregnant, that question again, but in a different manner, should think that whether COVID passes on. So what a pregnant woman should do if she has COVID?
See, there is nothing to worry. First of all, I would like to reassure all the pregnant women that there have been many studies which say that COVID does not pass to the fetus in any trimester. So rest assured, your baby will be fine. The only thing you need to take care is of yourself. Okay. you have to see your symptoms. You have to check your SpO2 and see your symptoms. If you think your SpO2 is less than 93% or you are breathless at rest, then you should definitely consult a doctor and get admitted. Okay. And see, pregnancy anyways is a very vulnerable state, not just for COVID, but for any disease. So that is why we have to, I don't know, our guidelines don't say right now that they should be vaccinated. That is a very, very crucial point that we should put forward to the Ministry of Health, that pregnant women and lactating, breastfeeding women, they amount for around 50 million of them in India. Just in a year, just in a year we are saying, and not to add on the ones who are going to get pregnant or who are already delivered. So such a huge chunk of population of pregnant and breastfeeding women we have in India. So I would like to really, put forward to come to a guideline whether they should be vaccinated or no, because we just have data about Pfizer's vaccination. Only Pfizer and Moderna have done studies on pregnant and lactating women, and they have been found safe. But Indian studies are yet to come out of Covaxin and Covishield, both being inactivated vaccines. They are not live vaccines, they are inactivated vaccines, but still we are lacking data in Indian women of pregnant and breastfeeding women. And I think so pregnant women being more vulnerable should take extra care, okay, not coming in contact with a COVID patient. If or there is a COVID patient in the home, they should isolate themselves, quarantine themselves. And mostly, see, the reassuring part is that COVID does not affect pregnant women like others, being a vulnerable state also. COVID is usually self-limiting. There are only very few amount of pregnant women who have actually gone to severe disease and actually succumbed, which is a very, very less, very, very less number. Maybe because pregnant women are more taken care of. We know they are vulnerable. Oh, there is a pregnant lady in the house. So even the mild symptoms are taken care of early, and they are admitted early, and they go to the doctors early. But the main thing is that they are the most vulnerable, and they should be vaccinated first. And there should be a data as soon as possible in India for Covaxin and Covishield that they should be vaccinated at the earliest.
Okay. And also, would you say something about people, going to COVID and finding a lot of problems? The earlier we heard OTP problem, getting registered. Do you think that's being sorted out?
No, that is not being sorted out. The slots are filling up fast, and there is shortage of vaccines. See, private people are not getting vaccines. Private hospitals are not getting the stocks. Talking about Mumbai, Navi Mumbai itself, I think 5 days to get a second dose for a COVID slot, for which even I had to personally go to a COVID center, take a token, and then they got vaccinated the next day. So by COVID app, it is really not helping. People are not getting OTPs. No, there is some problem in the app, or there is some problem in logistics.
Okay. Yeah, and a couple of other things. Do you see any gender ratio to COVID also? Would you say that more women get it or men, or would you like to say no, it's gender neutral? It's happening to.
I don't say it is gender neutral, but especially what happens is in India, we have a lot of men going out for work, and women are usually homemakers. So maybe then there may be skewing of the gender thing towards men, because they are more going out and for their work and work.
More exposed.
Yeah, so more exposed, and women are mostly homemakers, or in the house itself taking care of the kids and all. So maybe they are less exposed, and that is why the numbers are skewing towards the men. But otherwise, I don't think so. They're equally vulnerable.
Also about younger people. In fact, this, as Pankti was just saying, that a lot of young people we see have actually, in fact, left us. Why is this year it's happening in the second wave that we are seeing more young people going away? We lost very promising journalists also. Some of them are very young, and we get very shocked and surprised as to how they could go. Because last year we used to think, somebody has comorbidity and some of these ailments already that they have. So it looked a little kind of one could digest, but this time it's becoming very shocking. So how would you really look at that? The age factor.
So this time what happened is the virus has mutated. Okay, last year maybe we were seeing the original virus which was infecting was not so morbid. But this time for the second wave, we are seeing that since the virus has mutated, we are seeing a lot of number of young patients who are not just succumbing, but need a lot of oxygen and ventilators. So the mutation of the virus has caused increase in the severity of the disease, and also the hypercoagulate. As you said, as you mentioned, the reporters also, some famous reporters also expired. He was getting better and suddenly he's expired. So this time the virus has really, taken a toll on the psyche of the people. Suddenly losing somebody is really difficult to digest for anybody of us. But this time the virus has surprised us, showing a different type of symptom. See, previously people never used to have diarrhea. Diarrhea was a very, little symptom that we used to ignore. Diarrhea hota hai. But this time even diarrhea has come up as the main symptoms. If you have breathlessness and fever, fine, we know flu comes like this. But diarrhea has also come up. So this time the virus has really attacked us severely.
Okay, so to you, Pankti, we are seeing like this time, if I compare it from last year to this year, this time we are seeing such horrible stories around us. We are seeing crematoriums lined up actually with more number of deaths, which are very sudden, as we are discussing also. And there are challenges of medical kinds. What is it that we would tell people? We are, as medical practitioners, you're also dealing with the mental health problem. So the anxiety levels, the sense of loss, bereavement, how to deal with a panic, which is maybe not there in front, but we are assuming also that it will go higher and it will rise. How are you also telling your patients to maintain their mental calm?
So my main message is that we are seeing these pictures on television, on newspapers, and a lot of areas, and it is true that a lot of people are getting affected. We are running out of resources. Actually, both the things are occurring together, and that's also why we're not able to save a lot of people. That's also why we're seeing more deaths this time. But what I wanted to say is that most of the cases are still mild, just that you have to intervene at the right time. I think it's very, very important that the first day you have your symptoms, that is the time that you should be consulting your doctor. That is the time that you should be getting tested, and you should comply with your doctor. And what I have been seeing in my hospital is that most of the people who present present badly, or when they're in dire need of oxygen, most of them have had symptoms from 10 days. So on the 7th day is the day when your oxygen saturation will really fall. There's this misconception that if it's just fever and it's going away, then you're okay. That means you don't really need to do anything else. When people do not monitor their saturations, and then suddenly on the 7th day, the saturation falls. They don't get their reports done. They don't consult a doctor. And then on the 7th day, achanak say they have 88 saturation or something, and then they're not able to find beds, because the hospitals are already crowded as it is. So by the time that the patient actually gets inside the hospital or gets the resources that they need, by that time it's already too late. So, I think that what needs to be focused on is to spread awareness that this is not something, it's not like a COVID ho gaya, to matlab, definitely there is no cure, there is no way that you'll survive this. It's not like that. My family tested positive for COVID just 2 weeks ago. We were all home isolated. We all, since they're doctors, so we're also more aware. So we tested on the first day. We followed up with baseline investigations. We monitored ourselves regularly 4 times a day. We checked our temperatures. We checked SpO2. I was not positive, but my entire family was positive. So I did the work of getting supplies and all those things. But everyone, took extreme precaution, and they took the medications on the right time. So all of these factors, plus they're all vaccinated. So all of these factors come together and play a role in recovery, and each of them is very, very important. So, I feel like there's this misconception that COVID ho gaya, then there's no way that you'll survive. It's not like that. Actually, if you intervene at the right time, you follow the strategies, then there are more chances that you will recover. You never get to the stage where you need to be hospitalized. My mother herself is also a doctor. She's also been dealing with COVID patients, and she does teleconsultation for most of those patients. She's an endocrinologist, so she sees more patients who have comorbidities. Even they have, most of them have recovered. So it's not, I think that we need to tell stories about recovery as much as we're telling those other stories. I think we need to focus on that.
Interesting point that you have shared with us. We have to tell those stories. For example, your story that you are yourself a doctor, but your family, which is mainly of doctors, they became COVID positive, but how you were looking at supplies and how you were, because you were more aware, you were looking at how to medically handle situations. So these are stories that, and maybe Herbal India can do that, and we'll try and bring up such stories from you. I would also like to throw this house to the questions, maybe if somebody wants to ask. But before that, one favorite question, and which Dr. Sonali, of course, and I were discussing, is about कि वैक्सीनेशन इसलिए नहीं लगाना है कि वो प्लांट्स की कुछ बात हो रही थी, डॉक्टर सोनाली, कि so some kind of superstition attached to things.
Yes, I had a discussion with my friend who lives in Bangalore, and she said, I messaged her, how is, I was just checking on her, how is everything, and when are you getting vaccinated? So she's like, I am not planning to get vaccinated. Like, why? No, we are on a plant-based diet, so we don't need vaccination. Those who are meat eaters and dairy eaters need vaccination. So this all comes from all WhatsApp University. This is absolutely not true. It is absolutely not true. Not just this, yesterday also I got a big write-up from a homeopathic doctor, what you should eat and what you should not eat. There it is written, don't eat roti, carbs and rice. I'm like, then what to eat? Mukha mar jaye. Okay, and you should eat makhana. If you have COVID, you should eat makhana. I'm like, what rubbish is this? So, COVID doesn't select you, that you are a plant-based human, so I will not infect you. Or you are a meat eater, so okay, fine, you're more vulnerable, I'll go and infect you. So COVID does not discriminate between diets, okay, what people eat. So COVID, those who are vulnerable, COVID is going to get them infected. Okay, so we have, not just the frontline thing, not just treating patients or putting on ventilators and all. We are not fighting that. We are also fighting this misunderstandings on WhatsApp also, and that is a big headache. See, we can manage a patient in the ward, we can give him medications, we can give him oxygen and everything. But fighting stupidity on social media and on WhatsApp is a big task for us.
In fact, I must share it here that all those WhatsApp groups, there are fights actually, because people think they're almost semi-doctors and what they're saying is the ultimate truth. And that should be really followed upon also. It's not that they are only suggesting that if you do this, if you have Giloy, then you're just away. Then if you have, all kinds of things, turmeric, ginger, of course, these are good habits. But, just saying that only this much will help you and this much will not help you. I think the correct information to go out is, I'm sure, is very, very important. That's why.
Yes, Rakhi. One thing also I would like to clarify. There was one post also saying that menstrual women should not get vaccinated during the menses. So this myth also I would like to bust, that there is nothing like that. This article was published by a very reputed media house, and I really had bad time fighting it. Okay, so vaccination and menstruation are not related. You can get vaccinated while you are menstruating. There are no side effects. This myth I really wanted to bust today.
Yeah, in fact, you should go get vaccinated. And I'm sure you were talking about not talking, but I think you have to talk to the photographer who's taking your picture finally, which you put out on media. Just on a lighter note, I thought I'll share it. If there are any questions that you may ask, these are two very, very, I would say very on the ground kind of medical practitioners, and I'm happy, really, very delighted to talk to them. If there are any questions. And Dr. Pathak also, I don't know whether he's still there or has left, but he was supposed to be joining, or any other person who has joined us, because we saw a lot of interest initially when we carried out the poster. Is there anyone who wants to ask a question? कोई हिंदी में भी बात कर सकता है, अंग्रेजी में, जिस भी भाषा में. We also have a Panti from Gujarat, so you can ask, maybe try your languages, or Marathi. Marathi. Or maybe I have seen people are very shy. That's why I do most of the questioning. And, they otherwise ask you a lot of questions and they discuss things. But yes, when it comes to actually asking, anyone? No one?
Well, most of the questions have already been answered by
Dr. Pathak, finally.
Hi.
Please ask.
Well, most of the questions have been answered by Sonali ma'am and Pankti as well. And as such, I don't have any questions. I'm the one usually answering them.
Anybody? No, in fact, In fact, Dr. Pathak himself, has been answering our question on our earlier show. He was also there as a panelist, as a specialist. But he has been answering a lot of questions, busting myths on social media, especially on Twitter. He's being celebrated even as a medical practitioner. So I'm really thankful that on social media he's creating. Are you there, Dr. Pathak?
Yes, I'm right here. I'm
He's there.
listening.
He's
Yes.
muted.
I mean, these are two women that maybe you through social media, you know them. I don't know whether you want to ask a question or you want to supplement their thoughts.
I'll supplement the thoughts, as Pankaj said, about the main important thing being timing. If you have symptoms, get tested immediately. Don't wait for a positive report. Start an empirical treatment based on your clinical condition. That's the best thing you can do and you need to do. You can prevent all severe cases. It's absolutely possible to prevent severe cases, even in those with comorbidities, if you initiate the treatment at the right time.
Okay. Since Pankti announced that she worked with you under your guidance, Pankti, I'm also talking about the kind of coordination you have in such times where you take guidance inputs. This is also about learning from your seniors. Is there anything you'd like to share here now that Dr. Pathak is also here?
I think that the junior doctors that worked with me, they were my seniors. They were doing their post graduation. So I think that they also felt that this internship is supposed to be a learning experience. You're supposed to go to different departments and learn something from there, so that after a year you're at least a few basic things in every department. I think that it was really sweet that they did go out of the way to teach me at least something every day, even if it was like small things. Like they taught me how to see CT scans, and then they taught me how to take a sample and those things. So they made sure that my training wasn't all that much affected. And we would also often even have scientific discussions, even with the consultant who came every morning. Like he made sure that we learned something every day. Like he would ask us questions related to whatever branch they were in, and he would ask me general questions, and then we would discuss those things, so that we made sure that it wasn't just work. We also learned something, at least a few things every day. And it was a really good working experience, because it was like almost making new friends, because we would take breaks together.
Okay, SPV, come in. You raised your hand.
Yeah, I have one question that, see, during discussion, I found that after 14 days of completion of your quarantine, you need not have any test RT-PCR to be a positive one. But say somehow people in the job, they are asking for this RT-PCR and they are insisting on it to be a negative. So sometimes it happens that if you want to rejoin your job or duties, you will be asked from your company or from your employee to produce this RT-PCR negative. So in that case, what should we do?
Okay. Would you like to say something?
I think that that problem, that is a question that I had faced even last year. A few months ago, I made this tweet as well, that you don't need repeat RT-PCR testing. So many people asked that the government had said that if you want to travel across states, you need to get an RT-PCR done. Even if you are not symptomatic, you need to get it done. But recently, just I think yesterday or 2 days back, the guidelines from the government have now been issued that you don't need RT-PCR testing to travel across states. So the truth is that I think that there's already a lot of workload because of so many cases coming in. There's already a lot of workload even in the labs. That's why there are delays in getting reports also. So now the government will try to actually avoid these unnecessary tests. So you might expect that after a few days, at least your workplace might like abandon this thing that you need a repeat RT-PCR. Don't get tested if you're not symptomatic. That thing will come, because the government has already issued guidelines from their side that you don't need to get an RT-PCR done unnecessarily. So you might not, but there are still a few cases where you need RT-PCR to get like for example in chronic kidney disease patients, they need to go for an RT-PCR testing before they go for dialysis. So in such cases, it is not avoidable. You have to go for it. So I think that you may expect that they might see this possibility that they might not ask for tests after some time.
Okay, so that answers the question. But the one thing that I would say, and from my own experience, is that last year we saw some of you facing a lot of problems. That in societies and all, you were going to hospitals. Then people, when you came back, people were very angry with you that you come back with some disease itself or something. So a lot of anger that you have to face. This time, I think people know that they have to depend on doctors and their advice, and I think there is. I don't see that happening, at least this time also, because people have understand. And I think we must as a country understand that how much crucial health as a subject is, how much important it is, how much related it is to our daily lives every moment, and how we have to really respect health professionals, medical professionals, even especially women, I would say, because they are handling so much at home and they are going out and serving all of you. And I think we must respect and look forward in terms of supporting them and not really discouraging them anyhow. In one of the videos that we're playing earlier on Her World is about two women, senior women doctors, who talked about their plight as to how in PPE the whole day they could not even get much time to go and relieve themselves to eat anything. They're working in such conditions, isn't it? You would like to say something, Pankti, here? Some of the travails of being in the COVID hospital or duty?
Yes, actually, I do relate to that, because even if you're not wearing PPE, that the workload is so much that you almost have to remind yourself that you also are human and you need to, go and relieve yourself. You need to go and drink water. You need to go and eat. It's that hectic, because there are a lot of patients, and I have a few colleagues who are working even in places like the emergency department, where they have to wear PPE, and it's already very hot in like Anand and in Gujarat. It's the summer is going to peak now, so the temperature will be rising actually. So in all that heat, to wear PPE for 12 hours a day and work, it's very difficult. At the same time, you have to counsel the patients, their relatives. It's definitely very difficult. I actually make sure that my roommates don't get dehydrated, because it's definitely a lot. It takes a toll on you.
Yeah, so that reminds me of another thing, Dr. Sonali, that hydrating yourself is a great idea during these times, isn't it, Dr. Sonali?
Yes.
Some of these simple tips, if you could give to patients also about lessening their anxiety and all that, Dr. Sonali.
Yes, talking about COVID patients who are already infected, who have mild symptoms and who are at home, I would like to suggest them that first of all, rest assured that you are going to get cured. Okay, since you are at home, there are less symptoms. Secondly, you should get yourself hydrated, and thirdly, you should have a good high protein diet to fight against the COVID. What happens is COVID takes a toll on your immunity and it really breaks you down. I have had so many patients and their experiences post-COVID, they have a lot of weakness, they have giddiness, they just can't get up from the bed, they are dehydrated. So nothing to worry. These symptoms are actually treatable, okay, by good hydration and adequate amount of rest. See, now these days what happens is the disadvantage of being in India is that it's very hot in India. So you tend to get dehydrated not just by your disease, but also by the weather. So keep yourself in a good ventilated room where you get enough of air, okay? Keep yourself positive that you are going to get better. Eat proper nutrition, your diet matters a lot. I know it's not about vegetarian or not non-vegetarian diet. Again, I'm coming to that. But it is about a healthy diet. Eating twice a day, eating thrice a day, improving your diet, like having milk. You can have that giloy and everything and whatever you want, but we should not ignore the medications of the doctors. Okay, COVID being a multifactorial disease, there are many medications. There are like 7 to 8 tablets at a time that you might need to take. According to the doctor, you might need to take vitamin Z, zinc, vitamin C. You need to take all types of medication, ivermectin, hydroxychloroquine. All doctors give different kind of medicines, but whatever is suiting you, you have to take the medicines on time. Just staying at home and hydrating yourself is not going to help. You need to take medications on time, and you have to talk to a doctor. Don't self-medicate yourself. You have less symptoms, nothing. You have a WhatsApp forward of some other doctor treating other patient who is diabetic, who is comorbid. You never know. You're just copying the medications. Don't do that. Talk to a doctor and take proper medications according to what your symptoms are and not what other patient symptoms are. Just don't copy medications. And thirdly, do not take steroids on your own. People are hoarding that budesonide spray, you know, now that the AIMS guidelines have come, they're saying that budesonide asthma spray has come, steroid you should take. People are hoarding that. That is not needed. If you have mild symptoms, let your doctor assess what do you have. Let your doctor treat you and only then take steroids, because it is possible that post-COVID also you might have comorbidities. You know, it happened with my mother. My mother had COVID and she was non-diabetic, but after she recovered, she got diabetes. So it happens that after COVID also you can get, many people have got diabetes. Many people have tested for diabetes positive. So don't self-medicate yourself. The only thing I want to say is don't self-medicate yourself and be positive. 99% of cases are getting cured. So be positive. You should not consider yourself among the 2 or 3% of the cases who are getting on severe. And please stop talking to negative people around. That nahi, aisa hoga, vaisa hoga. Don't worry. Keep yourself positive and talk to a right doctor. Don't self-medicate yourself, please.
And I would also add to that, you know, though we are all on social media, but we are getting so much addicted also, and anything coming in, we are just quickly reacting to that. We are quickly believing that we should not, all of us should not do that. We should confirm, we should verify, and we should only look at what is correct, look for right guidance from the right kind of experts. And we here at Herbal India will keep doing that, also talking to some of you who are experts, and this is the least that we could do here as citizens of this country. Of course, there are bigger questions that we're also addressing on our shows. We are talking about health infrastructure. We've been talking to some of the senior bureaucrats, policymakers who are supposed to be arranging things for us. As Dr. Sonali, you said, our job is to look at patients and not manage things. So those managerial things and the systemic arrangements are also something that we are looking at in further shows. We will be talking to such people who really matter this time. And we're also going to talk to some of these people who are innovating. So in some future episodes, you'll also see innovators. So for example, people behind oxygen concentrators who are making it, people who are making masks at mass level very scientifically, people who are also telling us scientifically as to what can happen. But thank you so much right now to these two wonderful ladies who are going to be my friends now. It was such a pleasure talking to both of you, Dr. Sonali and Pankti. And of course, thankful to Dr. Pathak, who also keeps supporting us on our show in terms of inputs, advice, people, everything. And all the other people who are joining us. We are also thankful to Policy Center and Gender Lab of Miranda House. They have been our partners and they keep supporting us in many ways here. So that's it from now. I could really talk longer, I know. And since we are three ladies here, we can, I think, manage to do that. But let's end it all here. Thank you so very much.
Thank you so much for having us.
So much.
Take care. Take lots of care. Take lots of
care.
Thank you.
Stay safe.
Bye.